Hi Pharmacist City family, and as always, welcome back to our page. Today we're gonna visit a dentistry office to see what's going on in these days. Before this, anytime we want to make an appointment to visit our dentist, we all remember that weird sounds that we hear when we visit their office. Yes, that gives us a phobia, so we always try to postpone it and do not get extra pain for no reason by visiting our dentist. However, all this changed when we had pandemic in the US and all dentistry offices start closing. Since then, we start having a toothaches that we never had in our life. We had the worst pain. Everything that's not supposed to happen, it happened. And we were looking for the dentist. So, for that reason, we visit one of our dentists in the US, Dr. Nazanin Abulhassani, to tell us when now they're opening an office and they start seeing patients, what are some protocols and precautions they have to take in place from WHO, CDC, Public Health Department, and American Dentistry Association to make sure their patient feels safe and stay safe, and most importantly, all the dentists also stay safe, because this is one of the high-risk jobs they have in these days. If you're ready, let's do it! Hi doctor, and welcome to our page.
Hi, thank you so much for inviting me today. My name is Nazanin Abulhassani. I'm a dentist, graduated from Texas A&M College of Dentistry in Dallas. I'm so happy and pleased to be here today.
So our first question is, many patients now, they are patiently waiting and they had so many problems, but they were told to stay at home, treated at home until further notice that the offices get open. So when the offices open, what will be happen?
In order to keep the number of people limited and in order to protect each other from getting contaminated with this virus, so we try to prioritize our scheduling system, which means that we try to get in the patients who have pain, discomfort, infection, or something like that. We prefer to get these patients first, and then we're going to call up to our other patients who they are not in such an emergency situation.
So now, as a patient, when I call to make an appointment, is there any changes in appointment scheduling, something that it was not happening before?
Okay, the thing that is happening now is that we need to screen all patients by phone before scheduling, or even when we are confirming our appointment with them. So they're going to ask some questions such as, have you had any symptoms of exposure to coronavirus during the past 2 to 14 days? And then if you have any of these symptoms, please make sure to tell the person who is calling you to schedule or to confirm the appointment. The other thing is that you need to know that you cannot have any companion with you when you are going to your dental visit. So there is an exception if the patient is a child, or if it's an elderly, or if it's a special need patient. So definitely they need to have someone with them.
Now, if I make an appointment and I arrive to my appointment, well, what are the difference compared to before that I need to be aware of?
So when you get into your appointment, please call the office before get into the waiting room. So call the office and inform there that you are here, you are ready for your appointment, but just stay in your vehicle, okay? You cannot get into the waiting room because we want to have the limited number of individuals who get into the waiting area. So you're gonna stay in there until the chair is ready for you to get in. Then after that, they're going to call you and let you know to come into the office.
Are you cheating from your papers? It seems like you're cheating. I know you wrote them a lot. So she's really picky. So she wrote them, she printed them, she highlighted them. That's really good. Let's say I arrive now, I'm coming to the office. Once I walk into the office, what are the different things I need to do that I was not doing it before?
So when you get into the office, the first thing that you see is a COVID-19 questionnaire. So the questions are something such as, have you been tested positive for coronavirus? Have you been tested and you're waiting for the results to come back? Have you been exposed or in contact with someone who has been tested positive for the coronavirus in the last 2 to 14 days? Or do you have any kind of symptoms that is related to coronavirus? They're going to ask you, have you lost the sense of taste or a smell? And have you been traveling outside the United States for the last 14 days by air or ship, like cruise? Or even have you been traveling inside the US? So these are the questions that they are going to ask you first, and you make sure that you give them the correct answer, okay? The other thing is that you need to wear gloves when you are in waiting area. The other thing that is different from before is that you can't see any magazines there or any toys, for example, if you are going to a pediatric. So because sterilization is hard and because we want to minimize the transmission of this virus, so you won't see any kind of this stuff in the waiting area. And then after that, they are going to check your temperature with temple thermometer, and they are going to record that. After they record your temperature, they are going to guide you in your chair, and then they'll give you a solution of water and hydrogen peroxide. You're going to rinse and spit it. Well, it just depends on the medical situation. If it's your medical condition says that it's contraindicated to rinse with this solution, so you're going to tell your dentist or dental assistant that you cannot rinse with that.
Now the main question remains for the dentist. Dentistry now in this specific time is one of the high risk. It used to be high risk, it still is going to be even worse at this time. What are the recommendations for the dentist?
Okay, so let me give you a little background about dentistry. Many years ago, there wasn't any gloves, there wasn't any mask, there was no rules regarding that. After 1985, when AIDS and hepatitis B virus introduced into the world, something similar to what's happening these days, they started to placing a rule that all the dentists and dental hygienists or dental assistants need to wear PPE, which is personal protective equipment. So what are these? These are the ones which includes mask, eye cover, gloves, disposable gowns. After coronavirus happened, we still have to wear the gloves, we still have to wear disposable gown, we still have to wear the eye cover, something like goggles, but we also need to wear N95 mask, and on top of that we need to wear the level 3 mask, the regular mask. We need to wear that. One more thing that is needed to be worn is long shield. It's a clear shield. It starts from the hairline and it goes all the way down to the chin. So these are the personal protective equipment that we are wearing these days.
Already wearing one mask is hard enough, and now you guys have to wear 2 masks. That's going to be really tough for sure.
Really.
But that's whatever it takes for your safety and your patient's safety. In regarding the procedure, is there anything changed? For example, I know there is an annual cleaning that everybody get a reminder of. Should we go to those? Is there any changes or some stuff that we should not do at this time?
There is no such a thing that we cannot see any specific or we cannot do any specific procedure. Yes, we can, but we need to prioritize what we're gonna do. For example, if a patient has pain, infection, discomfort, it's a broken tooth, needs to be extracted, well, we cannot do anything about that. We cannot postpone that. So what we're gonna do is we just wanna tell everyone, when you schedule for dental appointment, make sure that you are in need of going to see your dentist. If it's something like annual checkup, please be patient. You do it in a better time, in a time that everything it's getting more under control.
Any last minute advice and last word?
Okay, my last word is that I appreciate all of you for being patient, and I would like to ask you to continue staying patient. It's a new situation. No one had such an experience before, so it takes time for all of us to learn how to deal with this situation. So if you do not have any pain, any discomfort, anything really serious, so please try to be patient until this situation gets more under control, and then try to schedule for appointment.
Perfect. We really appreciate you, Nazanin, for all this information. It's really useful at this time because we all want to make an appointment, so we want to know what we should know and then how to be careful. I know now you're patiently waiting to go because she's moving today, so we really appreciate that. And sorry we bother you at the middle of your moving process.
Thank you so much for having me here. It was a pleasure.
Since we have you, we want to say goodbye together. Just like always, we have a mission on our page. Nazanin gonna say our mission this time.
Be kind to your health.
Hope you like this video like always too. Till next video, everybody.